So I definitely feel honored to have received the Excellence in Education Award. I've always been passionate about education. It's something that even before I had applied to medical school and then throughout medical school and residency has been something that energized me and really created an additional depth to what I do. I teach the residents for their ultrasound training. I created the ultrasound training program actually when we started the residency. I also teach an ultrasound fellow, and I do a lot at the national level. Usually give various talks throughout the year. I've led several national workshops and have had the opportunity to do some education research as well to help others learn from what we've been able to do really well here at Rush. What drove me to really become more involved in education came from the passion to just really help others to learn more efficiently and effectively.
All of us have a purpose in life, and for me, since I was very young, my purpose always has been and was to provide care for the underserved community. When it comes to community service, I think at least my focus has been both overseas in terms of global health within the local community, for example, within the homeless shelter, as well as regionally within the rural communities of our state in Illinois. I'm grateful, feel privileged, and I would say that I share this award in spirit with so many of my faculty at Rush who do some amazing work.
The work that I've been doing that led to the Clinical Excellence Award for faculty began really in 2009 when I founded a primary care clinic for low-income food service workers at Flying Food out by O'Hare Airport, and that project really grew, blossomed and grew, and now we have over 30 community partnerships that have been built on that foundation, and we have students and faculty clinicians who get to rotate through all of these community-based clinics. For a long time I worked in hospital-based settings, and our patients come into the hospital doors and they're already so sick. And so I was really driven to move upstream to try to catch people before they have to come to the hospital for acute care. I feel so humbled to be recognized for the efforts that I've done in the community and with our students and faculty. What I would say is, the work that I do is really reflective of just hundreds of people's effort. And so I'm grateful for the award, but I dedicate it to all of the people that I work with to make this happen.
When I look back on my career, I feel like in some ways my journey has come full circle. I started my internal medicine internship in 1986, and at that time faced the first pandemic of my career, which was, of course, HIV. And my experiences during that time led me to become an infectious disease physician, and my clinical research site has now pivoted toward COVID-19 research. It's a tremendous honor to be recognized. I think the thing that, is most humbling to me is that several of my colleagues and mentors nominated me for this award. The fact that they did this is very, very a huge honor to me.
I've been lucky enough over the last 20 years at Rush to be not only mentored by some very talented faculty and peers here, I've also had the opportunity to develop newer tools to help us to be better mentors and to form these mentor-mentee relationships for our lives. The biggest thing that drove me was just the fact that it's you have to give forward. There were many people that invested time in me to develop my skills as a researcher, and there was always a feeling and a sense that you had to give back. The most wonderful experience is to see somebody develop their skills and grow. I'm truly humbled by the recognition that the Faculty Affairs Advisory Council provided in naming me as the mentor for excellence. It means a lot when your colleagues take the time to recognize you.
I first became interested in midlife women's health back when I was a master's NP student, and I wrote a clinical paper on menopause. And I was really struck at that time how little was written in the nursing literature about it. virtually nothing, and the literature that was written about it was extremely negative. So that's how I got into research related to women's health. I was actually looking for an alternative to hormone replacement therapy for women. I'm extremely honored to receive this award here at Rush University. I've been here for 13 years and I truly am honored. And I want to really thank very much the two colleagues of mine that put me up for this.
I think what makes our faculty so amazing is that all of our faculty practice. And then as a result, we get to bring that clinical expertise right into the classroom.
Yeah, I think it's the openness that makes the faculty at Rush excellent.
Excellence comes out of teamwork. I mean, the things I've been able to accomplish could not have been done without the help of many, many individuals.
The fact that I'm at Rush, I feel that it's a place that provides and supports me in terms of delivering this care to the underserved communities.
What makes faculty excellent here at Rush University is the collegiality across the universities.
Everyone comes together around whatever challenge we're facing